Another amazing story in the media. I mean, we have this whole situation in the Middle East that is basically, I'm reminded of the old metaphor that from the Cold War, and I don't know where it originated, but I remember it from when I was a teenager. That us in the Soviet Union, we were like two guys in a basement. Where there'd been a gasoline leak, and so we're standing in a basement room that's got an inch of gasoline on the floor, and we're standing there in the gasoline, and we both have a book of matches, and each one of us is threatening to light a match. I mean, that's the situation that we have in the Middle East right now between, on the one hand, Iran and their client states, basically, or their affiliated states, Iraq, Lebanon, and Yemen. And on the other hand, Saudi Arabia, Israel, the United Arab Emirates, maybe Qatar, and some of the other Sunni states, and the United States stepping in on the side of the Saudis and the Israelis. And, we're all in this room filled with gasoline holding these matches. So we've got that kind of just obscene behavior on the part of the Trump administration. But not only are they willing to risk war in the Middle East, risk the death of people in the Middle East, Trump is back to risking the death of people in the United States. And not just the death, also the bankruptcy. Joan McCarter over at Daily Kos wrote a really great piece about this a couple of days ago on Daily Kos it was yesterday on the 25th. It's titled, "Trump Administration Trying to Trick Obamacare Shoppers into Disastrous Junk Plans." And I just have to share with you the first paragraph and a half of what she wrote, because it's just mind-boggling. She says, Peter LaFrance, a 57-year-old Pennsylvania plumber, went to the doctor in early 2017 when his chronic shortness of breath got worse. So you following this? We've got this guy. He's a plumber in Pennsylvania. He's getting short of breath. Now, that can be a symptom of a whole lot of different things. Some of them, just a simple viral infection. Others, like heart disease or something. His doctor immediately sent him to the hospital, where he learned that he was having heart failure and that he also had type 2 diabetes. He was in the hospital for nearly a week. So here this guy discovers that he's actually got some serious illnesses. And he's in the hospital for a week. And he thought he had insurance. In fact, what he said to himself was, well, at least I have insurance. He had actually gone out and he'd bought a policy. He bought a policy from this company, according to this article, called Golden and Rule Insurance. And it was sold as being compliant with the Affordable Care Act. And everybody knows the Affordable Care Act compliant insurance has to cover pre-existing conditions and has to pay for your hospital stay, right? No. He got a bill, back to Joan McCarter here, he got a bill for $35,000 from the hospital, which was denied by his insurer because his new diagnoses were for pre-existing conditions. In other words, the insurance company said, we've only been insuring you for a year or so. Heart disease and diabetes don't come on in 12 months. You've obviously had them for a while, whether they were diagnosed or not, so we're not going to cover them. And he says, in fact, what he said, he told the reporter, he said, they basically said, I should have known I had diabetes and congestive heart failure. I should have been a doctor and diagnosed myself. He told this to the Philadelphia Inquirer. And, while he was easily able to find this health insurance plan online. In fact, if you go online and Google Obamacare health insurance, you may find the actual healthcare.gov website, which is where you can buy a real Obamacare policy. But odds are, before you even see that, you're going to see all kinds of sponsored ads that are for companies that are selling what they're calling Obamacare policies, but they're actually these emergency policies. Now, until Trump came along, there's this one single little loophole in Obamacare, in the Affordable Care Act, which says that for up to 90 days, and a maximum of 90 days, an insurance company can sell you a policy that doesn't cover pre-existing conditions. And the reason why they allowed that to be there was for people who just lost their job and lost their insurance, and they're going to start a new job, but it takes a couple months for the insurance to get processed to get the new insurance, and so they need a 90-day bridge. These are called bridge policies. And, with the expectation that, the old policy was covering your pre-existing conditions, the new policy will, and this policy doesn't have to. Well, Trump changed that 90 days to 3 years. And so these companies are now selling these policies and not telling people that they don't cover pre-existing conditions. He never saw the fine print. He had no idea. This is a bait and switch. And now Seema Verma, the head of the Centers for Medicare and Medicaid Services, has sent, this is from the Washington Post, quote, has sent at least 5 emails so far to individual market consumers encouraging them to use outside brokers, including through a service called Help on Demand, to sign up for health insurance. Now, all of these outside brokers are selling these short-term plans as cheap policies because they make huge commissions on them. So we're back to where we were before Obamacare. Now with this so-called Trump care. This is the new Trump care. Yeah, you short of breath, go to the hospital, $35,000 bill, and you have to pay it. And if you can't pay it, tough luck. You get to declare bankruptcy. You get to lose your life. You get to lose your job. You get to lose your home. You can go live in a car someplace. That's the new Trump health care plan.